Welcome back to our channel. If you are new here, welcome. In this channel we talk about chiropractic, health, wellness, and everything in between. So if that sounds good to you, go ahead and click the like button and subscribe so you don't miss any of our future videos. Now today we're talking about different types of chiropractic adjustments. And specifically, we're talking about the ones that are used for back pain. The reason why we talking about this is because a lot of times when people come into the office, they'll ask, "Hey, how do you fix this? What's going to happen?" And so we want to educate you guys a little bit more about the different things that we do. Now, there are many different types of chiropractic adjustments out there. Remember, not all chiropractors do the same thing. Some might be more gentle, some might be a little bit more forceful, and some may even use tools to perform their adjustments. But let us talk about the two main types of adjustments that are done by hand and focus on the ones that help with back pain. The first one is called a high velocity, low amplitude, or HVLA thrust. Now, this is probably what you think of when you think of a chiropractic adjustment. It's usually quick, it's short, and it's a very distinct sound that you hear right after. And so let's break down those words just a little bit. High velocity means that the motion is quick. Low amplitude means that the distance that the joint moves is really short. And thrust refers to the force that's used to move the joint. So put those together, and you get a quick, short pop into place. Now, not every chiropractor uses this technique, and it is not something that you have to get adjusted. But many chiropractors will utilize this technique for certain conditions. For example, if someone has acute back pain or maybe a recent injury, then this type of adjustment may be beneficial. This type of adjustment helps to reduce joint restrictions or fixations so that movement can be restored. And if there's one thing that we know about back pain, it's that staying still or being sedentary actually makes it worse. So by restoring normal movement, it also restores normal function. The second adjustment that we're going to talk about today is called the diversified technique. This is a low force, slow and controlled technique that doesn't involve a popping sound. Instead, it's more of a sustained pressure or stretching of the joints and muscles. This technique can be used for acute or chronic pain or even used for preventative care. So let's kind of compare these two techniques just a little bit. Now, we do both of these in our office. As you can see, both techniques are effective, but one may work better for you than the other. And a good chiropractor will be able to identify which one would be best for you. Now, let's talk about the HVLA thrust adjustment. Like we mentioned before, this is a quick and short pop into place type of adjustment. This is great for those with acute injuries or maybe a recent onset of pain. If you've ever been in a car accident, then chances are you've had this type of adjustment. This technique works really well in those situations. With an HVL, a thrust adjustment, the chiropractor will use their hands and sometimes their elbows to push or pull the joints back into alignment. When performing this technique, it's not uncommon to hear a popping sound. That sound is called a cavitation or a joint popping sound. You may have heard this before when getting your back adjusted or even popping your own knuckles. So what actually happens when a joint pops? Well, the popping sound that you hear is actually a pressure change within the joint itself. When pressure is released, gases within the joint expand and make a popping sound. Have you ever noticed that when you fly in an airplane that your ears pop? Well, that's the exact same thing. The pressure change causes the gases in your middle ear to expand, and that popping sound that you hear is actually your eustachian tube opening up. Kind of interesting, right? Now, it's important to note that you do unnecessarily have to hear a pop or a click for the adjustment to be effective. Sometimes the joint will just move, or the muscle will release without making a sound, and the adjustment can still be effective even if there is no pop. As far as the force that's used during an HVL adjustment, the amount of force used will depend on several factors. These include the severity of your pain, the duration of your pain, and the findings on your physical exam. Generally speaking, though, the force used is very light to moderate. And remember, if you're getting adjusted and it's too painful, then tell your chiropractor. Most chiropractors want their adjustments to be relatively painless. If it hurts, it's probably not done correctly. The second adjustment that we're going to talk about is called the diversified technique. Diversified is a low force, slow and controlled technique that doesn't involve a popping sound. Instead, the chiropractor will use sustained pressure or stretching to target the joints and muscles. And again, this technique can be used for acute or chronic pain, or even for preventative care. Diversified technique can also involve a variety of hand placements, such as behind the head, behind the neck, or along the spine. With this technique, the chiropractor will take a more gentle approach to help mobilize the joints and reduce muscle tension. This technique works really well for those with chronic or long-term back pain. And it's also great for pregnant women or the elderly. The beauty of this technique is that it's gentle enough to be used with almost everyone, but it's also effective at reducing pain and improving range of motion. So now that we've gone over the two most common types of adjustments that we use in our office, which one is right for you? Well, the truth is that it depends on a few different factors, including the severity of your pain, the duration of your pain, and the underlying cause of your pain. And only a qualified chiropractor will be able to determine that. If you're experiencing acute back pain, then either technique could be beneficial. However, if you're pregnant or have chronic pain, then diversified may be a better option for you. Ultimately, the decision of which technique to use is up to the chiropractor. They'll take your individual needs and goals into account when deciding which technique would work best for you. And remember, not all chiropractors use the same techniques, and there are plenty of other techniques out there besides just these two. Some chiropractors might use tools such as an activator or a drop piece to perform adjustments. And there are other adjusting techniques that do uneven involve touching the patient, such as remote therapeutic laser. So don't be afraid to ask your chiropractor what techniques they use and which one would be best for you. Ultimately, the goal of any chiropractic adjustment is to restore proper joint function and reduce pain. Now, whichever technique your chiropractor uses, it's important to find someone that you trust and feel comfortable with. Building a strong doctor-patient relationship is essential for successful treatment. Hopefully this video was helpful in giving you an idea of what to expect at your next chiropractic appointment. Remember, there are many different types of chiropractic adjustments, and each one is unique in its own way. Don't be afraid to ask your chiropractor questions and let them know your preferences. Thank you guys for watching today's video. If you enjoyed it, please go ahead and hit that thumbs up button and share it with someone who may benefit from this information. Don't forget to subscribe and hit that bell icon so you don't miss any of our future videos. And as always, remember to take care of your body because it's the only one you got.